Good morning and welcome to Health Matters. Today we are beaming all the way from Pleebo, Maryland County in Liberia. and we have our reporter that is on ground at the Pleebo Health Center, and he will be giving us a little bit of history of the health center, and he will be telling us a little bit of what we need to know about People Health Center. This is Health Matters, and we want to say welcome. We want to say welcome to all our viewers out there. And the purpose of this video is to bring to our attention, things that are happening in the health sector right now in Liberia, and whatever help that you can render, it will also go a long way. So we want to say welcome to the broadcast, and I want to turn over to our reporter out there in Pleebo, Maryland County. Moses, you are welcome, and thank you so much for bringing us this live broadcast.
You also welcome. So, like you said earlier, this is the Pleebo Center, and your friend and brother Moses J. Dao. Liberia, along with the again, welcome back from the break because of the fluctuation of the network system in Maryland. This is the Pleebo Center, as you can see on the wall there, and you also viewing the a sign given by a partners, international partner, referred to as Partner in Health, operating along with the Ministry of Health here in Pleebo. And these are services that have been offered here at the facility. You can see there, this is the maternity child health care services, and they are offering the family planning from, you can see the from Monday to Friday family planning, and the big belly is from Monday to Friday as well. They also have the high risk big belly from Wednesday. The time remains from 9 to 2 p.m. and labor and delivering services daily, that is a regular basis, and the postal clinic Monday to Friday. The important services daily, the mothers and babies vaccinations is the day remain Monday to Friday, and the free treatment for all big bellies. So free treatment for all big bellies, and the labor for love and compassions. You can see that the number of the ambulances of this facility is also being written below. So this is the facility, the Pleebo Center, and we anchoring or bringing you the live commentary of this facility. This is a government-owned uh, entity or institution, and we bringing you other side of this area. So again, let me just give you a few historicity on the Pleebo Health Center. According to research by those who are working at the facility, the registrar and other, the officer in charge, ORC in the medical term, officer in charge, and we were able to get in contact with them to acquire other basis information because of that schedule. So they are able to speak to our platform. But however, we're going to give you other basis information that we have gathered from them, and we just wanted to just keep posted as we share with you this information, these pieces of information to guide you and know basically when they say Pleebo Health Center, you're going to know what definitely we are referring to. So this is the facility. This is the facility, Pleebo Health Center. It's a health center that been operating. Before then, it used to be referred to as Merci
in a Francophone war or in the French war called Mini Thank You. So the Pleebo Center beginning was in the traditional town in Pleebo town area, where the government of Liberia, through a negotiation by family owners who had a piece of land that was just right by the road, and they thought it wise to have given that piece of land to the Ministry of Health through the negotiation of the local authority, and that place was given to the government, and it been in existence. But then the place name was Merci, where people used to come from the Ivory Coast, people used to come from other counties, because this place was given high attention by the government of Liberia, and medications and other medical supplies, including other, doctors coming on the annual basis to come to that place to provide medical supplies
We have Moses all the way in. We are bringing to you a tour of the Pleebo Health Center in Maryland County.
and where we refer to as the Merci, that is the genesis of this health facility. So the place was named Merci, and those who were working there, some of them now have been transferred to the Pleebo Health Center now, as we're referring to. So the Pleebo Health Center been operating in the 90s, and the coordinators and other personalities who were working back then now have their own health area, and they are running their own facility now. So, but there are other business information that they left with those who are in charge. So we just want to share them with you. So, like I said, the health center was given a land squatting, where through the negotiation of the local authority and the people of the area gave the land to the government, and the government have given it to the health practitioners. So when they all came together, they were using the place after a certain period of time, right after we came from the war, in the early 2006, 2005, when we came from war, after Madam Ellen Johnson Sirleaf won the presidency, in 2006 when she got in power. Later then, the family of that area who have given the land to the local authority, along with the Ministry of Health, to operate a health facility. Later then said that they needed their area that they gave to the government of Liberia, because it was not given to the government of Liberia on a free basis, but they were given to them to just be squatting. So right after the war, they have thought it was that again they're going to be having an extension in their family, so they needed their own land, they needed their own facility. So that place was given, that place was taken back from the health facility. So the government have decided to engage again the landowners, that is the people of Pleebo Town. So the people of Pleebo Town have given a land to the government of Liberia that is now in a full possession of the government now, which of course they have decided to relocate from that old area referred to as the Merci, meaning in the French word called thank you. They have moved from that area to a new location where the Pleebo Town people, the traditional people, are giving them a free land to build a government-owned structure. So this place was constructed by the government of Liberia, and it all started. It all started when the time of negotiation, when the people was thinking about removing the health administration from their own land. So the process started by the government, and the people moved from the old area referred to as the Merci, and they came to this new location referring to now as the Blue Health Center. So when they all came from there, they moved from that area 2015, July 15, and they moved to this new area that is referred to as the Blue Health Center now. So before we tour the facility, we also want to give you an insight. We want to give you insight on the facility. During the 2014, we have the epidemic referred to as the Ebola virus that came faster. that took over, meaning that took over Liberia, and specifically, we have other cases reported from Maryland, and from that backdrop, so the leadership of the health facility have thought it wise, along with the local authority, that again there should be a need that they have an extension for in case of an outbreak of any virus or any sicknesses or any bacteria, so that they can be able to handle them in the rightful procedures. So the government have thought it wise and were trying to plan. So they also negotiated for an extension of the land given them. So from that backdrop, the Pleebo town people are also giving them an extension of the parcel of land given them earlier. So they have an extension given to the people. So they have decided to fence the whole facility. Right after that, we enter 2019. 2019, we have the outbreak of the coronavirus. The virus also took over the world, and from that extension, from the negotiation earlier by the health authority and the local government, by going to the chief and the people of the Pleebo town to have given them another parcel of land so that they can be able to have an extension of the health facility. So from that backdrop, they did something. They have added an annex, additional
Our reporter out there in Maryland is still giving you a history of the Pleebo Health Center in
managed by
Maryland.
the partners in health. So the partners in health, they are also in line with the Ministry of Health, and as well as the providing health services to our people here in Maryland County. So they are operating here in Maryland. They are partnering with the government-owned facility, and specifically in the Mercy area. So before we go to the annex, when the Ebola virus break out, where people did not have the opportunity to have go or to have to have been carried for treatment. That is isolation center. People never had that opportunity. So the negotiations were made by the traditional people, and they have given an extension, that is another parcel of land, to the Ministry of Health, that is the local government authority, that this place is for the government of Liberia. It will not be taken from the government, and this is a government-owned land. So from that backdrop, in the 2019, where we have the COVID-19 case or cases in Liberia, they have thought it wise to have erected something, durable structure, that we're going to display to you on this broadcast. So keep posted as we bring you as we bring you the Blue Health Center. From there, like I said, it was named earlier Merci, meaning in the French word, meaning thank you. And today you can see that this is the Blue Health Center. This is the Blue Health Center. We're going to display other area. Okay, so this is it. This is the Blue Health Center. This is the laboratory storeroom, and as you can see, that this is the laboratory storeroom. Right after this area, we'll also go to the extension, the annex, that are constructed by the government through the partners in health family. This is another part of it. This is the dressing room. This is the dressing room. This is the dispenser area. This is the dispenser area where where they give drugs to the patients. This is the dispenser area where they give drugs to the patients. So this is the devotion area where people come for treatment and be seated, have devotion, have educate them, and right after that, you have to reach to the registrar desk. This is the registrar desk where you're going to reach to the registrar desk, and where your information going to be filed in the database of the health facility. So number are issued to patients who are coming to this facility. As for me, this my number is 111. That is the same number you can use to call the Lone Star CMGN office. My number is 111. So a specific number is attached to a patient. So as soon as you come here, even if you lost your health card, if you just call your number, you just dial the number, and definitely they will find all of your information, your name, your community, your father's name, your mother's name, and if your age and what have you. So all of the data are going to be displayed on the computer, and you're going to see every necessary information concerning you. So again, we are at the children area where children are normally vaccinated. Those below the from zero to from 0 to 9 months, where they are normally vaccinated. This is the area, and it's been managed by one Frederick. This is the facility. Again, this is another area where you go and test your weight. This area particularly is for the children. This is for the older one. This is the scale. So we bring to you for this broadcast from Maryland County, and I am Moses J. Dow, bringing you for this exclusive interview, bringing you the live happenings at the Pleebo Health Center. This is you can see the writing there is Partners in Health Office, and it's a facility also. mm, it's a facility given to the government partners. So this is the office of the ORC. Is a medical term, officer in charge of the facility, and we bring to you forth the this is the generator room. This is the generator room. This is the generator room. Okay, so this area is the waste area where waste are kept to be burned. This is the waste area where waste are kept to be burned, and this is the back of the office of the officer in charge, ORC office. This is another part of the facility. As you can see, the reservoir up there is for water because there's no running water here. So uh, this is as you can see, this is in the video there, a reservoir showing you that water are being used for other services at the Pleebo Health facility. So again, for those of you who following our broadcast, this is the Pleebo Health Center, and we just want to give you a picture on how the facility is like. So there's another part of this facility where they offer the mental health treatment. Those who are mentally ill, those who are mentally challenged, and children are given serious attention at this facility. And we're going to go directly uh, to that side. But before then, let us just complete the first view of the health center. That is when it moved here, 2015, July 15. From this area, we'll have to go to the extension that was also constructed by Partners in Health. through the Ministry of Health. So keep posted. Let us just give you.
You are watching 45 City
Yeah, yeah.
TV, and
So
this is Health
yeah,
Matters.
so I'm still here. I'm still here to give you uh, the picture at the health facility. This is Blue Health Center. Okay, so as I was saying, this is my information there on the dashboard of the computer. As soon as you come, you call your name. Even if you forgot or you mistakenly drop your card somewhere, you see that this is my name, this is my information, and this is how the process is like. So, records are kept in the database of this facility, and like I said, my number remains 111. So, this is my number here in the corner here. This is my number 111, and my name is in the database. So we're going to the other side of the facility offices where records are kept. This is the record area. This is the record room. This is the record room of this area. This is the record room. This is the record room where if you have any history of being reported sick, where they keep all of your information, whether you have, for example, you've been treated as as a tuberculosis patient, your information will be there on record, and as soon as you come back, they will know where you stopped, on your treatment at the health facility. If for any reason you went at any nearby area for another treatment, they're going to ask you whether you have attended, nearby drugstores or clinic for additional treatment, and which of the medication I was giving you before new treatment can be given you. So this is it. Offices of doctors, nurses. So this is the Pleebo Center. And before we go to the extension, like I said in our intro, the extension came as a result of the outbreak of virus in our global war, where viruses take over the world, and it first happened in 2014, where the Ebola virus break out in Liberia. Many persons died from the deadly coronavirus and Ebola virus, sorry, and now is coronavirus entered Liberia 2019, and according to records, is the reports of the coronavirus was the former director, that is the former EPA managing director, Nathaniel Blama, according to reports. So this is the ambulance of the facility. This is the ambulance, and this is the ambulance that carry patients to Harper, and it is here. It is here on a daily basis, assigned to the health facility. It is here. It is packed. when it's being called to any communities, go there for patients and bring them at the health facility. So this is it. So before we can, again, like I said, an extension was also erected here by the government after they have requested additional parcel of land from the traditional community people of Pleebo town. So this is the extension. This is the extension, an annex, additional area bigger than the area that they earlier moved in 2015, July 15, according to the reports that we gathered from the records keeper of this area. So as you can see there, this is the facility, the annex that were constructed by the partners, and the group name remained Partners in Health, who did this job. So this is the annex. This is the annex. We're going to go into the building. We're going to go into the building where you will see the information concerning this area. So this is the annex, and we want to say our folks who are following, this is 45 City TV, and we are live at the Pleebo Health Facility. So this is it. As you can see there, this is the Pleebo Health Center and Maternity Child Healthcare Department. This is another side of the facility, but however, we want to go to the maternity health child care area. So you got headache on the water. You can see the letter in the yellow. She got headache, and your eyes turning, and also you can see another lady there bleeding. We got excessive fatigue or shortness of breath. We got serious bleeding pain. Conclusions: baby stop warming, and so this is the record keeping machine. This is the record keeping machine. As you can see here, this is the computer where the database is being processed. This area. So this is the extension of the Pleebo Center.
Doris, Nima. Sorry, I'm calling you.
So, folks, this is it. This is 45 City TV, live there from Pennsylvania, United States of America. And I'm here broadcasting from Liberia, Maryland County, to be specific. And this is the children care area. So you can see their big belly. Check your big belly up to 8 times before delivering, and eat different foods to help healthy baby. So this is the children care, and this is the hangars constructed by partners. Yeah. Okay. So this is it. This is it. Let's just show you. This is it. This is check there carefully. You're going to see the Blue Hair Center, Metal, and Child Health Ward. So the mentally help those who are mentally constrained. They are treated here in this ward. Like I said, is managed by the partners in health, and they are now taking care of this area, this ward. You see, this is the children ward. This is the children ward, and this is the delivery room and other area. You see, this is a sick bed for patient. We going out. We're going out to again re-emphasize on our tour. So as you can see, people there close to the ER, another part of the facility referred to as ER. That is the emergency room. The E is the emergency, and the R is the room. So the emergency room, people are coming from, as you can see, people are highly assembled at the ER. That is there is a situation that need to be referred at the big hospital in Maryland County. So you can see there critically there's a situation as you can see the ambulance is parked, and when it's parked in that position, meaning that there is a situation that needs the attentions of the ambulance. So the normal position of the ambulance was a was where you can see this that guy standing, where you can see this mom is coming from. So the ambulance have left its normal position, meaning that there's a situation confronting the nurses at the ER, and they're going to do a referral shortly. So another area again added to this annex is a youth-friendly center. The youth-friendly center, it is also part of the facility here, and we're going to give you a picture of this area. We're going to give you a picture. So as you can see there, So, like to say sorry for a little bit while we've been. So this is it. This is a new area. Like I said, it's also being added to the annex, and you can see on the wall rating that the Pleebo Center Youth Friendly Center, and this place is being constructed uh, by UNFPA through Partners in Health and funded by the Embassy of Sweden. So as you can see there, this place was also added to the annex, and there are other services that they also provide here. There are other services that they also provide here, which includes the free. All services here are free, and the family planning remain constant. Like we visited the other side, this area as well also offers the family planning and the big belly care. Also, the delivering for pregnant people. Also here, the treatment for sexual transmitted infections. Also here, other services, outreach to provide services, health services to people outside of this area is also being given here. And in there, uh, workers of this area, this facility, like I said, is a government-owned facility being run by Partners in Health. And we just want to show you the facility. This is also part of the facility. You can see there. So we would like to just give you a little brief insight before we can finally close here on the Pleebo Health Center. So again, Pleebo Health Center, but then it was referred to as Merci, and Merci is a French word meaning thank you. And the health center when operating in the 90s, and but then the government did not have our own area, or did not have that area as a government-owned facility, but were just squatting, including the building they were in. So the government was using the old area in the Pleebo Town Bell, the Zone 5 area. Government was using that area as a way to be helping the citizens, giving them or providing health services for them. So that place was referred to as Merci, and the Merci meaning is thank you in French. So later then, when the people of the area who owns the property said that I think we needed our own place now, I think we have helped the government of Liberia to provide this area, including the building, for them to give health services to our people. So we have, an extension in our family, and we want our property back. So the government had difficulties in finding way out for the facility, and later then they met the traditional people of Pleebo Town, and Pleebo Town people have decided to give them this area, and this place was given to the government, and the local government presented this area to the health ministry, the Ministry of Health, and they have decided to erect the structure here that we refer to now as Pleebo Center. So when the area, when they erected this area here, they moved here officially on the 15th of July, 2015, years back. And when they came, they had one building operating only, and that place were referred to as the Pleebo Health Center, because from Merci, it transitioned to Pleebo Health Center, meaning that they were no longer using the word Merci, which means thank you in French. They were no longer using the word Merci, and they have transitioned from Merci to Pleebo Health Center. So Pleebo Health Center
Thank
now,
you.
looking at other services that they provide here. And when they came here, they also met an international partner referred to as Partners in Health, that also partnering with the government of Liberia, or in partnership with the government of Liberia. And they been here providing other services, other care, and providing other basis need for those who are attending the health facility. So from that draft, they have transitioned from the name Merci to Blue Health Center. Again, when we had the 2014, when we had an outbreak of Ebola virus, when the government had difficulties in finding a solution center, from that bad job, again, they have decided to have arranged with the same traditional people to give them additional parcel of land to be added here at the same area. That is an extension in the parcel of land given to them. So from that bad job, the people have agreed to give them another parcel. So the place is being extended. When they fence the area later, then they had we had the outbreak of the COVID-19 that entered Liberia 2019 through the area of
We want to say thank you so much for joining us. This has been a tour of the
PA
Pleebo
boss by chief
Center.
medical. Yeah. So this is the Blue Health
Yeah,
Center, and we
thank
want
you.
to just before we can conclude, perhaps there are other information that the manager want to ask before we can just turn out the broadcast.
Oh, well, thank you so much, Moses. Thank you. I know we have our the leadership of that clinic. Like you earlier said, they are like in a meeting, so we are
Yeah,
all
yeah.
able to talk to the officer in charge. But nevertheless, we just want to say it was good that we had a tour of the facility, and we want to say thanks to our viewer out there. And we also want to say this tour was all about bringing attention to the need in the in the healthcare sector in Liberia. As you can see, there's more to be done. There's more
Of
that's
course.
needed. So whatever way you feel that or you are able to partner with Pleebo Health Center or any other health center in Liberia, we will be bringing them to you, or occasionally, so you can see what is unfolding at these health centers. So there's no sufficient, you know, supplies. I mean, supplies, you just can't have enough. That's what I mean. So everything you
Yeah.
can do, anything you do, it will come a very, very long way. They still need all the help. They still need all the the they need medical equipment. They need uh, all the medication, everything that make a health facility very, very effective is needed. So we urge you, we encourage you to partner with the health facility to make it a better one. And those that are in the diaspora, and especially those that hail from Maryland, whatever little way you can contribute towards this facility is going to go a very, very long way. We want to say thank you for joining us this morning. This is Health Matters, and we're just bringing to you a tour of the Pleebo Health Center in Maryland County. And we will be back here again on Thursday for another edition of Health Matters. And we want to say thank you so much, Mose. Mose was uh, heading the OB crew in Maryland County, bringing to us live the facility of the Pleebo Center. We thank you so much, Mose, and we will be connecting with you again for another tour as we progress. And to our viewers, continue sharing the broadcast, and we will meet again on this Health Matters. Your health matters. Thank you so much for joining us. And I'm your presenter, Pastor Patience. And this is a presentation by the Fortified City Ministries. And we are here in the United States of America. God bless you and have a wonderful, wonderful rest of your day. You want to show us the health center before we close? You just want to show the signboard so we can we can close with that, please.
Okay. So let us go back to the sample before we close up.
Yeah.
Yeah. So for those of you viewing, like you heard from the manager in studio, you please have to do what it takes to be uh, a nationalistic citizen or patriotic citizen. To help give back to your community, give back to your country. These things, they yeah, who really have love for the country, who are willing to give back. So, but however, we encourage everyone to be, a help
Mhm.
to this broadcast
Yeah.
to bring a change.
Yeah.
Any other equipment can be used here.
Thank you.
Don't think that here it can also be
Thank
another
you so
other
much.
advantage. Everyone can make use of it. Yeah. So again, this is the facility,
Thank
the
you.
Pleebo Health Center.
Thank you.
It's also in partnership with the partners in health.